I ask to be recognized along with Senator Brown for Ohio for up to 15 minutes and to engage in a colloquy.
Without objection.
And I thank the Majority Leader for his kindness in letting us go forward. You know, I'm proud to stand up here today as a resident of Georgia and its capital city, Atlanta, which is the home of the Center for Disease Control and Prevention in America, a great institution to which Senator Brown and I are most familiar and want to talk about some of its great achievements here today. CDC is the nation's health protection agency, but it's really the world's health protection agency. What CDC has done is build a strong national public health and disease detection network for working with state, local agencies, private partners, and universities and communities to stop disease and stop outbreaks. By way of example, CDC led a multi-state response to last year's fungal meningitis outbreak that resulted in 745 infections, 58 deaths in 20 states. CDC identified and contained dangerous foodborne pathogen outbreaks such as hepatitis A found in frozen berry blend, salmonella found in the poultry industry, and E. coli found in frozen food products. CDC puts science into action every day to protect the American people, using breakthroughs such as microbial genomics to find outbreaks sooner, stop them earlier, and prevent them better. Environmental hazards, biosecurity threats, and natural disasters. CDC provided direct support within hours of the Superstorm Sandy that devastated Northeast last year. We need to be able to have CDC to be ready for this year's hurricane season as it deals with other public threats. CDC provides crucial information on the health status of the risks to the American people. The data it helps determine the best options for preventing illness, reducing medical costs. At a time when the U.S. government is not looked upon with a lot of favor by the American people, I think it's very interesting to note that a recent Gallup poll identified as CDC as the most trusted federal government agency with the American people. I think that's something we owe a tip of the hat to. Senator Brown?
Thank you, Senator Isakson. I'm so appreciative of the work that he's done with Centers for Disease Control in his home state of Atlanta. There's no federal agency that quite like the CDC in this country or across the world. Our nation's fiscal health can't be strengthened. It cannot be strengthened at the expense of our nation's public health. In the 21st century, it's easy to overlook this country's public health safety net. Too often we take for granted that our children aren't being crippled by polio or dying from whooping cough because we have immunizations. We take for granted that we have stronger teeth and less tooth decay because of water fluoridation in many of our communities. We take for granted that few people in this country now die of infectious diseases like cholera and tuberculosis because we've made the kind of remarkable progress we have in sanitation, in hygiene, and antibiotics, and disease surveillance. We take these advancements for granted because for over 6 decades, the CDC has been doing an extraordinary job of ensuring Americans have basic health protections. The CDC's work, along with that of other public health advocates and researchers, is credited with increasing the average American's life expectancy over the last many decades, increasing the average American's life expectancy by 25 years. 25 years, a quarter of a century longer because of our investment in public health. The CDC's reach and responsibilities, as intimated by Senator Isakson, aren't limited by our country's borders. Due to globalization, it matters a great deal how other countries respond to health threats, and the CDC plays an essential role in helping their international partners react to these threats. The CDC is the gold standard, the global leader in disease preparedness and public health prevention. Other nations follow our lead. Yet the CDC's leadership is not guaranteed. Even with its top-notch facilities and world-class staff, the CDC faces challenges to this continued leadership. The CDC's base budget authority is its lowest level in a decade. The fiscal year 13 budget is about $600 million below its fiscal year 2012 level. This reduction undercuts the health security of all Americans, even those that never once think of the existence of the Centers for Disease Control. Reduction in the CDC budget has harmful immediate and long-term consequences across the U.S. and around the world. This reduction affects the ability of our state and local health departments to provide on-the-ground services. As my friend from Georgia explained during his discussion of the deadly fungal meningitis outbreak, funding the CDC is critical to the foundation of our public health. When we invest in CDC, we invest in the health of families in Coleraine, Ohio, and Cuyahoga Falls, Ohio. When we invest in CDC, we support programs such as the Epidemiology Laboratory Capacity Program that addresses infectious disease threats. When we invest in the CDC, we ensure our state and local health departments on the front lines are able to detect the first signs of outbreak. Without this critical funding, we leave ourselves vulnerable to the initial spread of health threats, such as fungal meningitis and emerging new diseases, such as the MERS, coronavirus, and the novel H7N9 avian flu virus, which we read about. Public health departments across the nation have unfortunately already lost thousands of jobs and will lose more if CDC continues to dwindle. And then before turning it back over to Senator Isakson, I'd like to emphasize a point he made, that the CDC responds to long-term health threats as well as to urgent, immediate health dangers. These threats don't make the headlines. So much of CDC's work you never hear about, you never read about, because its name, Centers for Disease and Prevention, Centers is such an important part of this. CDC continues a long-standing tradition of working in partnership with many international organizations and global partners to ensure that our country takes the lead in stopping these threats. I've had the pleasure of seeing CDC's dedicated expert staff working in Africa and in Atlanta and in communities like Medina County, Ohio, and all over the world, working to keep these countries and our communities healthier and safer and keeping Americans safe as well.
Will the Senator from Ohio yield for a moment?
Sure, I yield to Senator.
You know, I ran a company for 20 years, and a healthy workforce that was ready and willing and able to go to work every single day made a big difference. A lot of times we think of CDC, we think of outbreaks in Africa, we think of Ebola, we think of salmonella, but in fact, it's also an advocate for wellness, better health habits, and a healthier America. Don't you think that's important for the productivity of the American people and the American worker?
Yeah, I thank the senator from Georgia. I think that's exactly the point, that the CDC, while perhaps those who know of the CDC, and obviously in the state of Georgia, people know it more intimately than in my state, they more likely think of CDC doing something in Africa or Asia, not so much what it means locally. We know that our hospitals, for instance, are sometimes havens for unnecessary illnesses due to healthcare, to infections acquired in the hospital, antibiotic-resistant superbugs such as CRE, a family of germs with high levels of resistance to antibiotics. I wonder if my friend is familiar with CDC's work in these areas, if he would expand on that.
I appreciate your focus on that. You know, my friend from Ohio is exactly correct. The antimicrobial resistance is a serious threat to our nation's health. Many bacteria have become resistant to multiple classes of antibiotics. And I might add a personal note at this point. 3 years ago, I developed a MRSA infection in a hospital in Atlanta and almost lost my life to an antibiotic-resistant disease and infection. So I know how important it is to have a research facility like the CDC that can constantly stay one step ahead of the evolution of defenses these microbes bring up themselves. As a recent example, recent outbreak of drug-resistant CRE, where 1 in 2 patients infected with the bacteria unfortunately passes away, CDC must have resources to quickly track and stop outbreaks and give healthcare providers timely information. Without that, you have the risk of a contagion.
So that's certainly right. It seems there are new, emerging, and potentially dangerous health threats. We obviously know of the disease of the acquired infection you just mentioned. We know now of the H7N9 bird flu and MERS. How do you see, Senator Isakson's CDC's unique role in tracking and attempting to prevent the spread of these threats before they reach our shores, before we in American hospitals at Grady Memorial or at Med Central in Mansfield, Ohio, might be victims of that?
Well, you make a great point, because CDC is kind of the crucible where all the partners in healthcare in the country come together. You might remember when we were here on 9/11/2001, shortly after the attack on the Trade Center in New York, and then the anthrax letters started being mailed to Capitol Hill. It was CDC within days that tracked down the anthrax and helped us develop the defenses so we didn't have a problem with the anthrax infection and got the Cipro distributed to those who were exposed to keep them from succumbing to that disease. That's the kind of timely effort that you need from an agency like CDC to be able to quickly respond. Public health security is a component of our national security, as evidenced by the anthrax case. Potential threat of engineered biological weapons, CDC remains vigilant and ready to act with experts and countermeasures to protect the American people. With emerging diseases such as MERS and H7N9, CDC has sent teams around the globe to investigate their origin, develop and ship laboratory diagnostic kits to the affected areas, and save lives day in and day out in the world.
Well, if the senator would yield again for a moment. The MERS was identified recently. CDC scientists, as you know, developed and shipped a diagnostic kit to be used in the field. Talk about, you know, one of the things that when I've talked to people about public health and about, you know, certainly the importance of NIH, but especially in the focus in public health of CDC, we talk about polio and what CDC did to address and not quite yet wipe out, but in our country certainly wipe out, in most of the rest of the world, the polio virus. Give us a little bit of history and how important that was and what we learned from that, if you would, Senator Isakson.
Well, you know, when I grew up in the 50s, I remember taking the sugar cube anti-polio vaccine, the Jonas Salk vaccine, for the first time ever. Polio has been a dread disease that's affected the American people and people around the world for years, but now it is almost totally eradicated. Why? Because of a worldwide effort by many organizations, not the least of which CDC, is to see to it that the inoculations are made available. In fact, polio now only resides in 3 countries, Afghanistan, Pakistan, and Nigeria. We're close to closing the door and having a polio-free world, just like we're getting closer and closer to eradicating measles, which now primarily still has an outbreak in Nigeria. CDC's readiness and ability to deploy at a moment's notice makes all the difference in the world. I don't want to sell here, but I have to make one note. One of the reasons CDC is in Atlanta, and that's such a good location, is they can be anywhere in the world in a matter of a day by the Hartsfield International Airport, and not a day goes by that somewhere around the world a country or a community calls and says, we need help. We've got a problem that we don't know what it is, but it has to be identified. And CDC scientists and doctors are put on the planes and fly around the world to diagnose, identify, and provide the cure so the disease does not get into an outbreak that takes thousands of lives.
Thank you. And in closing, I want to just close with a personal story about polio. My brother, born in 1947, was of the 3 of us and 3 boys in the family. My brother is the oldest, my brother Bob. And when he was in about the 1st or 2nd or 3rd, maybe the 3rd grade, my father, who was a local family physician in Mansfield, was asked by, if not the CDC, some national health organization, to give polio vaccine in Mansfield, Ohio, as there were doctors in other communities asked to do that. And they chose my father in part because he was a good doctor. They also chose him because he had a son, had a child that was in 2nd or 3rd or 4th grade at the time. And people were afraid, they weren't sure about injecting that vaccine into their arm because a lot of families thought that actually could cause polio. There was all that fear. Scientists didn't believe that, but an awful lot of people did. So there's a picture on the front page of the Mansfield News Journal in the mid-1950s of my brother getting a polio vaccine. It was, I believe his was Salk. Sabin came later with the cube. He got the Salk vaccine administered by my dad. And CDC or one of the public health groups, I apologize, I don't know which, made sure that happened all over the country so people could be more reassured. And that was really the beginning with Salk and then Sabin of the eradication of polio in this country. And it's hard to think back. The presiding officer is not old enough that Senator Isakson and I can remember with our parents the fear in the until into the 1950s of parents that their child would go swimming and might come back as Franklin Roosevelt did with a case of polio, and whatever the causes of that virus spreading scared so many people. So I think in these days of hyper-partisanship consuming Washington, I appreciate the work of Senator Isakson on working together with CDC, because this is far and away more important than any political kinds of differences that we might have. And I'll let Senator Isakson close.
Well, I appreciate very much the Senator's focus on CDC. And I think it's ironic we close talking about Franklin Delano Roosevelt, because in the 1940s, as our president, he suffered from polio. It would take the train to Georgia and go down to Warm Springs to get the therapy of those warm springs, which then was the only mechanism of treating polio. Today in Georgia, because of CDC, we have a mechanism of eradicating polio. That's the type of evolution we want to see in healthcare for not just for our country, but for the world. CDC is the best investment of American tax dollars we could possibly make. I support it wholeheartedly, and I thank Senator Brown for his participation in the colloquy today. And yield back the balance of our time and suggest the absence of a quorum.